Referral is an integral part of the counseling process. As a counselor, your job is knowing appropriate resources and linking your counselees to them.
Frank, we've been exploring the anxiety, depression, and loneliness that you've been struggling with for some time. We've talked about your sleep problems, eating problems, fatigue, and other symptoms as well. We've also examined the way you've coped, particularly with using alcohol. Now, when someone has been down long enough with the symptoms as severe as yours, it's often helpful to consider a full-court attack on the symptoms.
Well, that sounds good. I'm willing to try anything to help me feel better.
I think it would be helpful to both of us in managing some of these symptoms if you were to see a colleague, Dr. Gallows. As a psychiatrist, Dr. Gallows is specifically trained to evaluate individuals to determine if medications might be helpful. I know some people are concerned about taking medications and seeing a psychiatrist, yet their skill set and ability to prescribe is an invaluable resource in helping people get better.
Yeah, I don't know. I'm not crazy. I don't need to see a shrink.
No, you definitely are not crazy, and I understand your reluctance. You've had a hard time with your symptoms, which have gotten the best of you. I can help the psychological and spiritual end, but psychiatrists can better address the physical side. Psychiatrists don't shrink you, but use their medical training to determine if medications would straighten out the chemicals that get out of whack when someone is depressed.
So, what you're saying is you think he could help me to sleep better and to have more energy?
In a manner of speaking, yes. I believe that medication, if deemed appropriate, will go a long way in helping you get through this dark valley.
Okay.
Well, I'll contact Dr. Gallows with your permission and relay the referral information to him. Now, I can either make the appointment for you or you can go ahead and do it yourself.
No, I'll make the appointment myself.
Okay, perfect. I'll write down his number for you. Now, you be sure to sign a release form so that I can allow Dr. Gallows to communicate with me about your case.
Okay. Well, let's give it a whirl.
I know you've never seen a psychiatrist before, so let me prepare you for the visit. A psychiatrist is a medical doctor, so sometimes their forms and approach is strongly rooted in a medical model. Unlike many psychiatrists, Dr. Gallows has a lab in his office. He often does a brief medical evaluation, including lab work, in addition to a psychiatric interview. The interview will be a lot like the first session we had, which with a much stronger focus on symptoms. If he prescribes something, he will often give samples for you to get started. Now, he'll schedule more frequent follow-ups first, and then less as you respond better to the medication.
All right, well, let's do it.
A psychiatric referral is a common referral for counselors to make. It is important to get to know the psychiatrists in your area. Know how they accept referrals, their approach to medications, and how they work with counselors who are not part of their practice.